Hello, this is Dr. Shamima Sattar from the YouTube channel Doctor to Help. Today is our first YouTube program live show, and we are going to talk about how to save money on medical bills. For those who don't know me, I'm an internal medicine doctor, board certified, practicing in Texas. Uh, I have finished my residency in 2006 and have been practicing in the USA since then. I did 11 years as a hospitalist, 3 years in ER, and rest of the time is been clinic. Right now, I am working online in two different telemedicine group. One is Teladoc, everybody knows about it, and the second one is drsays.com, also getting very famous very fast. Okay, so if you guys have any questions, feel free to ask questions in the chat so we can talk. Otherwise, let me just jump in. As a doctor, and a person who is very, very cautious about spending her money for herself, and completely opposite for my kids, I like to save money, especially on my medical bills. So it's very important for me to make sure I'm not paying too much. I had insurance for about 20 years. Every year I paid $4.5 to $5,000 in health insurance. And guess what? I had no medical problems. All I needed was lab work once in a year to make sure everything is okay. So the only thing after 20 years I have is pre-diabetic. Otherwise, I have no issues. And I watch my diet, I do exercise, my blood work has been beautiful. I did it a year ago and it was fine. So why am I paying $5,000 a year for health insurance? I could have saved $100,000 for my kids' education. So that did not make any sense to me. So I dropped my insurance. But of course, I'm always terrified that if I get sick and I go to the hospital, I'm going to have $50,000 to $100,000 bills. So I did some research and I wanted to talk to you about, in general, how to save money on medical bills, all the way from your prescription, doctor's visit, hospital visit. All right. So let's start with the smallest one, prescription. If you don't have Good RX app, please download it right now. Good RX, GOOD, and separate RX will stand for pharmacy. RX stands for pharmacy. If you don't have that app in your phone, download it right now. When a doctor gives you a prescription, look under Good RX and see how much your medication costs in different pharmacies. So, if your pharmacy doesn't have the best price, guess what you can do? Ask your pharmacist, can you give me a coupon to match this price? If they say no, then maybe you should just go to a different pharmacy. So talk to them and tell them that, if you don't give me the best price, maybe I'll go somewhere else. Can you help me out? Just be nice about it. And they might come up with a very nice price. Next, I'm going to talk about lab test. Before I move on about the medication, those medications that are expensive, you can also go to their website and see if they have coupons there for you. They might have a coupon. If you cannot afford it, they might even give it to you free. So look at their website and see if there's something they can do for you. And also touch base with your churches, your religious places. People might be able to help you out if you can't afford anything. All right. Now, next, we're going to talk about lab test. What are we going to do about lab test? I remember I used to work at a hospital. I'm a doctor, right? I don't know how many times I was billed wrong for lab work. I got a bill of $885 for just annual lab work. It just comprised of CBC, CMP, lipid panel, thyroid panel, and A1C. That's it. I got a bill for $885. And I was like, what on earth? I have insurance and it's supposed to be 100% paid. So I kept on calling billing person, months over months over months. Almost after a year, I found out they never billed my insurance. They sent the whole straight bill to me. That was not the only time it happened. It happened to me again. My son was sick. It was after 12, and I had to bring my son over to the hospital I work, and I got him tested for flu. So when I did the test, guess what? It was negative. But there was a whole hullabaloo that I am spreading the infection. I couldn't because I didn't have a choice to go to the clinic because clinics close at noon on Friday in my locality. So I didn't have a choice but to go to my hospital and I registered him and I got him flu tested and I got a bill for $450. I was shocked. I was like, normally I don't get a bill if I go to a doctor's office. And I know if I go to certain pharmacies, if I get it done, it's like $10, $15 just to get it done. So I was like, why did I get such a big bill? After months and months of calling, the same person over and over again. Finally, on my third month, I talked to a different person. And guess what? She also told me it was not only billed as a hospital code, it was billed without insurance. The insurance was never sent a bill. So I am paying for my insurance. I'm also paying the full price for that test. So, yes, please follow. Make sure you are properly billed. Same thing will happen in the hospital. When you get a hospital bill, don't just pay for it. Please ask them for an itemized bill. That means everything they charge for, they should put it out and there should be a code to match it. If they don't match, you can write a letter to anybody in the management and complain. Look, this is not right. You overbilled me. Correct it right now. Please say it nicely. You can correct it. All right? So do not hesitate to let people know. My kids just walked in from home, and of course, they don't understand what is live video and they're jumping all around. So hopefully, we'll get them out of my room in a few seconds. Nothing private is get out of my room. Nothing private is being told, and I'm not with a patient right now. So feel free to ask any question, just jump in, and I'll be happy to help you. So, ask for an itemized bill. Ask also for any codes that does it match with the treatment you got at the hospital. If it doesn't, write to the appropriate authority and question it. And hopefully you get lucky. When you're also admitted in a hospital, you want to make sure is it an inpatient status or an observation status. That also affects the bill. My husband was admitted in the hospital one time for 1 day observation. The social service person came and told me, please put in inpatient, that way your bill will be less. No, the bill went up $1,000. I complained and complained, and I was told by the insurance company that since the bill was under his name, he will have to be the one to call them and correct it. And guess what my husband did? He never called them. And I was like, okay, why am I trying to save his money? I will let it go. So we paid the higher bill. Do you really want to do that? I know you don't. So the last one I want to talk about is lab test. When you do labs, do you need a doctor to write you a prescription? Obviously, you don't want to go to a doctor for annual lab work and then a second visit for a follow up. And then if there's no problem, you're just going home. As far as me, I don't want to waste 2 to 3 hours going to a doctor's office for a prescription refill or a lab test. You can go to ultralabtest.com. You can also go to anylabtest.com now, any lab test now. You can check on your Google, go on your phone, do a Google search. And in that Google search, you can put in any lab test now or ultralabtest.com, and then you can search and it will show you which location you can go. You don't need a prescription to do it. So do it. If anything is abnormal, then maybe make an appointment, see your doctor, take your lab results, and say, Doc, what do I need to do? You saved a visit, and your private doctor's visit is always more expensive. So remember that. You don't want to pay a high bill for your doctor's visit. I don't know about you. Most places, even with insurance, you have to pay copay for $25 to $30. If you don't have insurance, it can be anywhere between $174 to $274. That's what my visit was from my hospital when I was running a clinic. So you really don't want to pay a high price, right? So shop around. Look at any lab test now or ultralabtest.com. Most of the lab work is 12.5 and some specific higher ones would be culture, STD. Those will be higher. So look at the price and see what you want to do and you don't want to do. Okay? And I work with drsays.com. If I go and do lab work, this annual basic lab that my insurance company, my bill was $885, it's only $92 for members. And if you are not a member, it's $112 without insurance. How can you beat that? You can't. So, if you don't have any insurance, I would say the best telemedicine is drsays.com. And I'm not saying it with any inhibition because I know it for truth. I work with Teladoc. If you have insurance, go to Teladoc. They will give you very well subscribed, very well guided, FDA guided treatment for you. So they have, because they bill the insurance company, they have to maintain a lot of documentation to support their bills. So usually more time consuming. That's why I try to stay with doctors2says.com, and I work with Teladoc only when they need extreme help. So far, it has worked wonderful for me. So just to say that if you go to drsays.com, if you're a member, all your visits are only $25. If you're not a member and you have only one single condition, it's $29. You cannot beat that price. And if you need refills, also, no matter how many amounts of refill, if you're a member, it's only $25. So go there and sign up, because membership is only like $3 or $4 a month. Any other places the subscription is more than $10, 10 or more. So it's very, very worthy. And drsays.com is all over United States. I am not again being paid by my boss to do this service, to do this video. I'm doing it to help you out, because even I didn't know about the subscription thingy. My friend who saw me in Dr. Says told me about an annual membership that even includes any kids that's below 18. So if mom and dad, I would suggest mom and dad, whoever is more sick, you get the membership and keep the other partner as a non-member. And if you need four visits for refills anyway with your doctor, it's worth getting an annual membership. And that way your kids will be seen under that membership, and that one membership will pay for all of them. And you can get your child 4 and above being seen in drsays.com. It's the best service there is. And I did my research. And believe me, if there's anything cheaper, I would tell you. So, yes, on drsays.com, you can do phone visit, you can do video visit, and you can see any doctor. You can choose your own doctor. When you click on the doctor's name, it will show you a drop down list, and you can choose your own doctor. And no, I'm not trying to get you as my patient. I have too many patients right now. And every month, I'm trying to decrease my hours. No matter what I do, my numbers are still saying the same. So I am quite burned out. I took only 5 days off in 2 years. So, yes, I want some rest. All right. So, feel free to ask any questions you have. If you have questions, put it in the chat or even later on in the comment, and I will answer your questions. Thank you for joining me, and take care. I will see you maybe next week. I might, if I see the response here, I might decide to do one every week. All right. Take care. Bye bye. Love you all. Ta ta.